This is Pauline. So essentially what we would do on an initial visit for a new patient, chiropractic visit, is the first visit would be spent learning a lot about the individual. So asking in detailed questions about, the mechanism of injury, what happened, where the location is. Does it refer the character of the pain? Is it, pins and needles, numbness, tingling, or is it a dull, achy pain? Or is it maybe muscular? So just teasing out these little bits of information can give us as practitioners a clear understanding of what's going on underlying the tissues. So what we'll show you here, we'll do a brief range of motion assessment. We won't do any treatment today, but we just want to show assessment of sort of how would we assess them. Okay, so if you want to have a seat here, Pauline. Okay. So initially we would assess Pauline's range of motion. So Pauline, if you want to just bring your chin to your chest, okay, and then looking up to the ceiling. Okay, so we're looking for any range of motion differences. Is there any difficulty leaning back or bringing her chin to her chest? Oftentimes when she brings her chin to the chest, if there was any issues, it would usually be up in the top part of, right underneath the base of the skull. Bringing your ear to your shoulder here. Okay, and then the right ear to the shoulder. Good, back to the middle. Okay, looking over your right shoulder. Okay, and looking over your left shoulder. The same thing, just looking for any differences, and also just palpating those joints, feeling for any differences in the joint play, any difference in movement there. All right, and then if you have standing up for me, okay. Same thing, just a general screen of the lower back. So I'll just get you to try and touch your toes. Good. Any issues with that at all?
Bit tight.
Bit tight in the back part? Yeah. Okay. And then coming back up and just extending back as far as you can go. Okay. Any issues with that?
I have like pain in the lower back.
On the left side?
Both sides.
On both sides. Okay. All right. And then running your right hand down the side of your right leg there. Okay.
Like then, all the way down.
No, that's okay. And then the left on the left. Perfect. Okay, back up. Stacking one arm on top of the other, twisting over to the right shoulder. Yeah. And then the left side. Okay. How's that there? Any issues with that? Okay. Perfect. Having a seat. All right. And so usually at this point, once we have an idea of what her range of motion is like, we'd have her laying face down so we can have a real deep palpation or feel of the tissues and the muscles in her lower back. If she did report any pins and needles, numbness, tingling, we could also do some sensory checks. So basically looking at her dermatomes or myotomes, looking at what level, if there is a difference from left side to the right side. And also some of her deep tendon reflexes. So like a patellar reflex, tricep, bicep tendon reflexes, to see if there's any deficits there as well. Now, other things we can do, so that's more of the neurological assessment. We can also do an orthopedic assessment to see, what exactly is the issue. Like we can pinpoint it. Is it maybe more of a disc issue, or is it a sacroiliac joint issue? We can really hone in with some orthopedic assessments. So even just teasing questions like, oh, and do you have any pain when you cough or you sneeze? No, she doesn't have any pain in general. However, that's a common disc related question, just asking through the history. And then from there, after we've deemed it safe, and if we do find it necessary, we may take x-rays. So Pauline, are you okay with me showing some of your x-rays? Yeah. Okay. So, for example, with Pauline, we've identified that on her right hip, it's almost 2 millimeters or 20 millimeters higher than her left. So this gives us an idea of how how we would treat her and the different muscles that are attaching to that ilium and the lumbar spine as well. So, and how we would go about treating her that way. So in total, a range of motion assessment, neurological assessment, orthopedic assessment, and potentially X-rays if they're indicated. And yeah, from there we would create a plan on how we would treat them. So, with chiropractic care, there's so many different ways that we can help people with low force techniques. Most commonly associated with chiropractors are the manual techniques. However, some people we just know aren't comfortable with those, and that's totally fine. We have other ways of treating them. Some manual soft tissue techniques as well. And at our clinic, we also offer decompression therapy, which can be very valuable in conjunction with some of those other therapies. Even things like shockwave therapy and class 4 laser are newer techniques that are really good for degenerative conditions like any kind of frozen shoulder or knee arthritis, for example, just to name a few.